Hey, we're live
We are.
on Instagram. Instagram is a social media platform that just came out. If you don't know it, it's I think getting pretty popular.
I think a few people are on it.
Yeah, there's another one called Facebook.
But you wouldn't think that Matt knew that because on his own Instagram page, he has two posts, and I think I posted one and somebody else posted the other. So.
Well, it shows my age. I'm active on Facebook, and she's more active on Instagram, and, you know, a little age difference there. But somebody between the two of us has a birthday coming up.
I do.
Saturday.
Quarantine birthday.
I know.
It's going to rock.
We're going to make it special. We're going to just we're going to stay 6 feet away.
Well, I did hear that if you have a quarantine birthday that it doesn't count. So I just stay the same age for another year and I don't have to count it.
It's the Benjamin Button birthday. I'm wearing a hat because my hair is so freaking long right now. It's just crazy. I mean, I can't imagine how busy hairdresser, cosmetologist, whatever stylists are going to be. It's going to be crazy.
It is going to be crazy. Yeah. Thanks for the birthday wishes. That's very thoughtful, especially from Sammy since it was your birthday too this month.
A lot of April birthdays. Even my family. My mom's birthday was April 8th. My brother's birthday was 2 days ago. A lot of birthdays in April.
So many.
And we've got a lot of our staff. Tracy, Sammy, who else? Andy.
Lisa, Lydia.
Yeah, all these April birthdays. But you know, thank you all for joining us. You know, we're trying to keep in good contact with our staff, with our wonderful clients, and just friends during this crisis. What's really nice, what I'm so optimistic, is it seems like there's light at the end of the tunnel.
Yeah.
There's a lot of good news coming out about more testing. There was a study that was just put out by Stanford that was really interesting, showing that we may be off 50 to 85% more people may have had or have now coronavirus than thought. And you say, well, why is that good news? Because these people didn't get that sick. And so if that's true, and it looks like it is, that means the mortality rate is way, way lower than they initially thought. So that'd be good news too.
Yeah, that would be good news.
And the state of Kansas right now is saying that May 3rd is the date that we may reopen, which is only a little less than 2 weeks away. Kansas City, Missouri is saying May 15th. So we don't know if Johnson and Wyandotte County are going to marry up with Jackson and Platte County and do that, but we're hopeful, and we are going to put some protocols together, because once we open, it doesn't mean the virus is gone, and we'll put out a video about all the things that we're going to do to make our clinic as safe as possible, because obviously that's our number one priority.
So does that mean that we will be able to open aesthetic care, but we'll be quarantined at home?
It just is
Kansas
not
City,
fair.
Kansas, Missouri
I know.
I don't know.
Yeah, because we live a block on the Missouri side, and our clinic is half a mile on the Kansas side. So
yeah.
So but we'll see. But we're excited, and our team is staying so focused. We're going to be better. We are studying. We're creating new protocols, new manuals. We're reading books, and we're all staying active. So. But today, we've got some fun topics to talk about, don't we?
We do, and I saw that Meredith joined, and I haven't seen her request. So maybe, Meredith, you could send the request again. That way we could kind of get you going on here right now. So if you, I know you're on, because I saw you a minute ago.
Meredith is one of our wonderful nurses, and who has a wonderful, diverse background. And today, we're going to be talking really about sexual health. The male and the female, and we do a treatment here called diVa, which of all the vaginal rejuvenation treatments is really the best on the market. It by far is above and beyond anything else on the market. And Meredith just joined us. Good morning, Meredith.
Hi.
Good morning. Hi.
So one of the reasons why we also want to have Meredith on this morning is she is a provider. She's a nurse at Aesthetic Care, and she also does training for us through our training center, Mint Aesthetics. And so she's worked with a number of physicians and nurses across the country, teaching them this procedure as well. So, she's actively offering the procedure at Aesthetic Care, but she's also a great trainer. So we thought we'd have her on, and she can help us answer some of the questions that have come out, and then just talk with us through it.
And if you, for those of you who don't know about diVa, diVa is for vaginal rejuvenation. It uses similar laser technology as our Halo, but it's designed for vaginal tissue. And what they found through years of clinical study is, as women get older and they've had kids, there's issues, incontinence, lack of lubrication, painful intercourse, dryness. And, there's been medications for stuff like that, but they found that these types of treatments are so effective. And so Meredith is going to be our expert panel, and we're going to ask Meredith some questions. So, Meredith, first of all, if you wouldn't mind, just describe the treatment. What happens during this treatment? Because I know a lot of people, this is a very personal thing. They may think, oh my God, painful? Or, you know, how many people are in the room? You know, how embarrassing is this going to be? So kind of walk them through what the treatment entails.
Yeah. So we do the consultation, which answers all those questions, because it is kind of a personal treatment. So it's a little different than some of the other things that we do. So we want to make sure everyone's comfortable. But mainly from start to finish on the day of, it's pretty straightforward. And it's actually one of the least, if I say this right, one of the least uncomfortable procedures that we do, I think. I've had it done and been doing it for 3 years now. So we do numb. So we numb internally, and if we do external rejuvenation, we numb externally as well for about 30 minutes.
And when you say numb, it's not numbing with injections.
Right. Yeah. Good point. It's topical. So it's just topical internal, and it's topical external. So there's no needles involved. And it's not new technology. It's just used differently. So we just use the halo technology, which you guys have discussed. So it's the 2 lasers inside the vagina, and it just stimulates collagen in the mucosal tissue. So it's just a little bit different, and it's a lot shorter than the halo. So once I start the laser treatment, it's about 8 minutes. So it's pretty quick.
Yeah. So clients that have had halo, you know, it's a 20 to 30 minute procedure, and they're on fire afterwards.
Yes. Yeah. You
so
don't feel
I think, you know, I mean, I've had
really
as well, and I was shocked to see that. I mean, compared to halo, it's one thing that's like, we talk about it in terms compared to halo because we know how the lasers are built, how the technology, you know, how the wavelengths work, you know, based on, I mean, in terms of like ablation versus non-ablation, all the technical piece to it. But I think in the past when I've talked to women about it, they're like, well, halo, I was on fire.
Yeah.
I don't want it to feel like that down there. And I was so surprised the first time I had diVa because it felt nothing like that. I mean, it was almost like I had nothing done after the treatment. Is that what you're seeing pretty consistently?
Oh yeah. And actually you don't have a lot of nerve endings inside the vagina until you get to the lower third. So that's really the part that we numb. And then there's no heat like the halo. It's just, the technology is just used a little bit differently. So you walk out of there, a lot of my clients, I would say 9 out of 10 say they feel like nothing happened.
Well, so just to step back a little bit, what are some of the conditions, you know, Matt said, you know, as women get older, this and this and this changes, but what are the main things that you see our clients come in for that they're concerned with, that they would like to see improved?
Mostly painful intercourse. So the technical term is dyspareunia. And then it's
and what causes that? That?
Lack of lubrication, and painful intercourse, any traumatic event, so childbirth. If you've had chemotherapy with cancer, your tissue's thinner, you don't have the rugae in the vagina that simulates the lubrication, lack of blood flow, which happens after we lose estrogen. So anytime you've lost lubrication anywhere, it's gonna be a little more dry, which causes pain during intercourse.
From what I understand too, menopause, you know, it's prior to having diVa, you know, personally, I mean, my mom never talked to me about menopause. My friends never talk about it. We get together for wine, and it's very rare that these topics come up, except for now, because I bring them up with the technology we have.
Well, it's because you're 29. You don't love it.
That was my birthday present.
I mean, nobody really talks about it.
But nobody talks about it.
Yeah, it's even doctors.
Single one of us.
Yeah.
Every single woman, every single female has, you know, whether it's you had a baby or you fought a horrible disease or you hit menopause. So at some point in our life, we're going to be going through some degree of this, right?
Yes. Yeah. And then after menopause, life doesn't end. You still want to have intimate relationships. And you want it to be enjoyable for you. So, So yeah, it really helps. All it does is just stimulate that tissue, the collagen and mucosal. So it's a little bit different than the skin on our face. So it heals a lot faster. And the way it heals, it just brings more blood to the area, and more blood to the area just means it's producing more lubrication, which helps the dryness, which helps the pain and sensitivity. It increases sensitivity. More blood flow to the area helps increase sensitivity, which makes it more comfortable for the woman.
Right. And I think, you know, so it helps with painful sex. And then you were mentioning the second, which is mild incontinence.
Mild incontinence, yeah. So the vagina is in charge of holding up a lot of anatomy. So the bladder, the uterus, and even the rectum. And as the tissue just like on our face starts to thin, we also start to thin inside our vagina, which then you're losing some of the structure. So the bladder starts to fall and the urethra starts to dilate, and that's what causes stress urinary incontinence. So anytime you cough and you don't have anything stopping it, like your muscle from which we use the Emsella for, or the thickness of the tissue, then the urine just leaks out. So if we can thicken that tissue, it really helps a lot.
Well, we've had, so many clients that have come in and have just talked about how much this has changed their life because of that. For years we've done Botox and facial treatments and things that were cosmetic, but this was really, well, other than like acne or acne scarring, but it's functional. It's just different. It's a different approach to treatments because it truly can change their life.
Well, one thing that was interesting, and Meredith, you might remember this, I think, so we always try to train with the best of the best. Mm-hmm. And so we researched who was one of the top vaginal health experts in the country. And it was Tammy Hsu, a nurse practitioner, PhD. We flew her to Kansas City, yes. And had her spend, and she's been in female primary care or women's health forever. And her stories about cancer survivors were just amazing. And I think that's probably one of the most gratifying things for us is when you see a cancer survivor who, one lady hadn't had sex with her husband in 3 years. It was too painful. And I remember telling her, she thought, my marriage is going to end because of this. And she had her 3 diVa treatments, and she said everything went back to normal. It was wonderful. And that's pretty amazing because people think, oh, why is it so important? It is important.
Oh my gosh. For people like that, it's hugely important. And, so it's that piece. And then it's also the incontinence where, again, that's another thing women don't sit around and talk about. Oh, I had 2 babies and now I can't jump on the trampoline with them anymore. Or my allergies come in, I sneeze and I pee a little bit. Like, nobody wants to talk about those things. And yet so many women are dealing with it on a regular basis to some degree. And so, there's just not a lot out there that is offered medically that's not invasive, not a surgery, not a medication. And so maybe talk about that a little bit.
Well, a lot of times when I have the consultations, a lot of women that I talk to are coming in really apprehensively. And I'm one of the first people that they've even spoken to about it. So it's a lot of anxiety. So we go over a lot of those questions that they have in the consultation to make sure you want to make sure during this procedure specifically that people are comfortable with it and the expectations. But not a lot of people talk about things. One of the things we do, and I also can offer a lot of information in addition to the diVa. Hormones in addition to diVa is really helpful. So we recommend that with our Dr. Carter. So people can get pretty emotional. And then after having the procedure, a lot of people have been very happy. And then they feel more comfortable talking about it, which I think is important.
Right. I think most of the time it's just like they feel like there's no other option. I mean,
right.
Having your OBGYN talk to you about it before you have the baby, and then they don't really see you after until, maybe your once a year type of checkup, and then it's in and out in 15 minutes type of thing. And so really, I feel like I have been educated on this way more than I could have ever imagined, just getting to be a part of it in aesthetic care. And I still out in my medical, my regular medical routine, I still don't hear about other options. It just like,
I haven't really, there's a couple other different lasers out there. I think the diVa offers are really good. I think it's a really great option in comparison to all the other laser treatments out there, just because it's very quick. And it has a dual technology, so 2 lasers. So you're offering 2 different things. And then in conjunction with hormones. But other than that, a lot of doctors and a lot of OBGYNs just aren't even talking about it at all. I think it's just coming to the forefront recently. So.
Well, I think one thing is OBGYNs on a whole are not used to doing cash pay business, treatments that are not covered by insurance, and this is elective. But you talked about other technologies, and, we know quite a bit about them. One of the more popular technologies out there is a 28-minute treatment. 28 minutes for urine stirred, which, who wants to do that? The other thing, if you look at, our medical director and on our advisory board, Amy Carter, OBGYN, she chose this over all the other devices. Johnny Pete, one of the top OBGYNs in Texas and wellness, has this. Nathan Garrett, who's one of the country's top urogynecologists, I gave a talk with him in Dallas and said, this is by far superior to any other vaginal rejuvenation treatment on the market. And even, a lot of it is the device is, to be honest, it's incredibly expensive to buy this device. But, when we decided to get into this, we were going to offer only the best thing possible.
Well, I love your point about the experience itself. So Meredith had mentioned, the laser portion of the treatment is only 8 minutes with diVa. And this other device that Matt brought up, I worked with it years ago, and I mean, it's 20 to 30 minutes. Yeah.
That's a long time.
The technology is going in and out, and it's just awkward.
Yes.
And so I love that Sciton, the manufacturer of diVa, came up with this technology that's, one, more effective and efficient. Like, it works better in the end in terms of results, and it's so much faster. But the one thing I do want to point out is that their treatment time or their appointment time is not just that 8 minutes.
Right, exactly. Yeah. So we numb for 30 minutes. We also make sure everyone's comfortable. And then once we get started, it's 8 minutes, but we usually block I tell people to block about an hour and 15 minutes to come into the treatment.
And there's some other things we can pair with it. Talk a little bit about what you do with PRP.
Oh yeah. So we pair PRP with it. And one thing I want to mention about the technology, it's all customizable. So that's why we have the consultation. So based on the individual, each person's medical history and their specific concerns, we customize all the settings. And then we add PRP to it. So platelet-rich plasma, which just all that does is just stimulate, again, more blood flow, which stimulates more collagen, which stimulates more and decreases the healing time. And then one thing to bring up as far as downtime is it's about 48 hours of downtime. So nothing inside the vagina for about 48 hours. That, again, is all dependent on the person's medical history and what we've decided to, how we've decided to treat. But really it's about 48 hours. And with the PRP, it really is about 48 hours.
And then you can talk with the PRP, you also do something as an option, the O shot.
Oh yeah, so we can do the O shot, and that is for external stimulation really only. We can do a little shot inside the G spot, which is the little space between the urethra and the vagina, and that is injecting the PRP directly into the tissue, which stimulates more collagen, and that again just thickens that tissue between the urethra and vagina, which helps hold up or decrease the dilation of the urethra, so it helps with stress urinary incontinence more so than anything. But then the O shot specifically helps for stimulation, so increases chance of orgasm if you're having an issue with it.
Everybody's always happy to have one of those.
Yeah. That's always good.
I think there's been a lot of those
we
going
gotta talk
on.
about the girls too.
I think there's been a lot of them going on during quarantine.
Yeah.
There's gonna be a lot of babies born next December and January.
Uh-huh.
Oh.
No, but I think
I think my rosacea just went.
Yeah. But I think
We have a
one
treatment
of the
for that.
neatest things about this is what Kathy said is it can be life-changing for people. Somebody's been married for 20 years, a woman's had 3 kids, and it's just not what it used to be. And the fact that there are ways that you can do it, and cost-wise, I think, just to talk about cost, tell people kind of approximately, we recommend a series of 3 treatments once a month.
Yeah.
And then depending on your age and stuff, maybe 1 or 2 a year for maintenance, not series of 3, but 1 or 2. So, and just tell people for 3 treatments, approximately how much is it?
I think we offer for the diVa, and then with the PRP, it's $1,250 per treatment. And then if you get 3, I think we get 10% off. And I usually recommend people just to remember to do it. Make it a birthday present for yourself every year. And then we offer 20% off lasers then too. So, or get it during the holiday. And I have a lot of clients just come in every year on their birthday.
Yeah.
It's smart.
I think it's a smart thing. And I think overall, one thing, there's a site called realself.com that a lot of people go to because doesn't take any advertising. It's what people believe in a treatment. Was it worth it or not? And I think to this day, diVa has the highest patient satisfaction of any elective treatment here. At one point, it was 100%, and I think it's about 98% now, which is literally higher than Botox. It means once somebody's had that treatment, virtually almost nobody is unsatisfied with the treatment. So that's always nice.
Yeah.
So Meredith, you've been.
We talk about Emsella.
Oh yeah, and so now we're going to talk a little bit, Meredith, about Emsella. And so this is really unique. And I mentioned a urogynecologist, and Nathan Garrett, national speaker, wonderful guy. And he said in his talk, for women, the combination of Emsella and diVa is the home run.
Yeah. It's
the home run. And Emsella is the only FDA cleared device for incontinence. And it's actually cleared for mild, moderate to severe. But also, and we'll talk in a minute, let's talk about women first, about what it can do for men. But Emsella is about the muscle in the pelvic floor. And so, Meredith, kind of talk about how that can affect not only incontinence, but also the sexual aspect of it.
Well, it seems with men and women, it's muscles. So the muscle in the pelvic floor for women is, again, responsible for holding up a lot of anatomy. So it just stimulates more blood flow, strengthens the muscles to hold up the anatomy. And then in conjunction with diVa, helps with the tissue thickness.
And what is so amazing about Emsella, and Emsella uses technology that's very similar to an MRI. And you sit in a chair and you are not naked. You have your little pair of shorts on or whatever. You literally sit in for 30 minutes. When that technology causes these contractions of the pelvic floor, it is not painful. We recommend a series of 2 treatments every week for 3 weeks, so 6 treatments, and then maybe 1 every 3 or 4 months for maintenance. But it is pretty amazing when well, first of all, standalone for incontinence, it's probably the best thing out there. But if total, sexual health, vaginal rejuvenation, you pair that with diVa, that really is about, and people say, oh, it's the best non-surgical option. It's probably just the best option because there's not really good surgical options.
Well, yeah, and as women, we all go to the OBGYN and they talk to us about doing Kegels. And, I have met with, I did a talk with a pelvic floor specialist at one point. She was telling me that most women aren't even doing them correctly. Which, I mean, that's one of the difficult things is, number one, are you doing them? And number 2 is, are you doing them correctly? And the Emsella device forces the body to do over 11,000 Kegels in 30 minutes or just under 30 minutes. And so
nobody can do that in a day.
Oh my gosh, or I don't know. I probably don't do that in a year. Come on, let's be honest. And it's like back to the point of, as women, we're like petrified or at least nervous, or you don't like going to the OBGYN and putting your feet in stirrups. And so being able to walk into the clinic, you put on a little pair of shorts, you're sitting in clothing on a chair. And I'm actually going to sit in the chair in a few minutes so that everybody can see what that looks like. I've got it right next to me. And it's, you can read a book or watch a show or, listen to a podcast. And it's just such an easy treatment to have that you walk in, you have the treatment, you walk out, there's no downtime. It doesn't hurt. And while those 2 treatments are so beautiful together, for somebody that's really timid, that doesn't, that's a little bit nervous, you could also start with Emsella and then add diVa on as you get comfortable and you get to know us a little bit more in aesthetic care.
Well, Emsella is totally not invasive, like we said, and there's a huge benefit for men. So as men get older, and most men will tell you at night they have to go to the bathroom more. As they get, in their 60s and stuff, they want to sit by the bathroom in the airplane. Long car rides, they're getting out more often, that urgency. So this is a really good device to help with that because that's, again, about the muscle. But the sexual aspect of Emsella for men is when you think about what happens in this little graphic in an orgasm, it is caused by a muscle, the contraction of a muscle. Well, as we get older, that muscle weakens. And I had one doctor say, it's kind of funny when you're 21 and a man has an orgasm, it hits the ceiling, and when you're 61, it dribbles out like syrup. And he was, and I know that's kind of graphic, but that's the muscle. And how many muscle contractions can you get? And this really changes that. And a neat story, a good friend of ours, husband and wife, and obviously I won't mention names, but she had 3 children, mid-50s. She went through the series of diVa and Emsella. He went through the series of Emsella. And she wrote the nicest letter saying, this has totally changed our sex life. It is just so much better. The sensation for her, her incontinence, which was gone, but for him, that how much better and more powerful sex was.
Right.
It was really neat. And these are good friends of ours.
Well, he also said, so his orgasm was more powerful, but he could tell a difference in her. And he kept saying, she's just more fluffy.
That's good.
I don't know what that means. But...
Well, actually, I got to tell just really quick the story of our client. And I won't name names or anything, but she came in and she was walking around our open house and talking about her experience with Emsella. And she's just this outgoing, friendly, great woman. We didn't ask her to do it. We didn't pay her to do this. But I love how she explained Emsella too, for her kind of not only for the stress, the mild incontinence issue, but also for sexual health. And so I walked up on her telling these, other friends or clients about Emsella and what it did for her. And she said, in my 20s, I just always had a tingle. There was just this tingle. And I hit 30 and my husband would walk in the door and I'd feel that tingle again. And, you know, you hit 40 and it's like, well, a couple weeks goes by, maybe there's no tingle. And then, you know, 50, it's like, oh boy, where's the tingle? And she said, Emsella brought my tingle back.
Oh, that's great.
And that's a clinical, that's a medical term. Tingle.
Hey, but it really, I was like, wow, that's what, it did that for me too. I didn't have a way to verbalize it yet. So I loved how she put it, that it sounds so innocent and cute, but yet how amazing is that?
Well, it helps relationships, and you want to maintain that relationship as you age. Things change, and we just want to change with it.
Well, and another thing that this was interesting, obviously would never hope somebody goes through a divorce, but stats do say 50% of people do go through divorce. And another thing this OBGYN is talking about is, you know, a lot of people, if they get divorced in their 50s and they literally have not had sex with another person for 20 or 30 years and their bodies have changed, it's like, what a great way to kind of get your sexual function in shape, you know.
Work it out, like they're working out their bodies.
There you go. So, and it is, you know, the Emsella is all about the muscle, the diVa is all about the tissue and that combination. Then you throw in the PRP. It's pretty amazing. We worked with a group, two wonderful, you know, female doctors from Florida, if you remember. And down in Florida, obviously, there's a lot of retired people. And their business is thriving with these type of treatments. You know, so many people coming in, and you know, people are being more active in the 60s and 70s, and that includes sexual health.
Definitely.
And if Suzanne Summers was on some entertainment show, I saw a thing, and she's 71, her husband's 72, and they said, you know, what are you doing during the quarantine? And she goes, well, we're having a lot of sex. And I mean, these are the 70s. And she goes, every Tuesday, my husband gets his testosterone injection. And she said, so Wednesdays are really good. But what Meredith, you said, you know, our doctor is wonderful with hormones. And if those of you out here who, you know, your energy levels are low, you're not sleeping well, your workouts aren't good, your libido is low, it's amazing. Go have, you know, see Dr. Amy Carter. She'll draw your blood, look at your levels of testosterone, estrogen, progesterone for women, vitamin D. And Kathy and I both do it. And once a month, we have pellets inserted into a muscle and the glute. And it's a slow time release. And I'm telling you guys, it is amazing. Not only your libido, but just your energy levels and your mood.
Your workouts are better. I mean, everything. And I think that's, you know, one of the things for women, you know, when we talk about vaginal health, it's all inside our body. It's not like we can see what's going on. You know, my face, I can see the laxity or the wrinkles or the sun damage and all of that. But in the vagina, I mean, you just don't see it. And yet the same things are happening.
Oh yeah. And when you decrease when all your hormones decrease, then your vagina starts to atrophy, and then you don't feel like doing anything, and then you relate sex with pain, and then you go longer without having it, and then it atrophies even more. So these treatments and hormones can just bring you back up.
Yeah, kind of a snowball.
Yeah, and I love, you know, obviously we've got different options based on, you know, our clients' concerns and how they want to start. But you look at like how you get the best body. You work out, you eat right, you know, you do supplemental and nutrition, you sleep well, you drink water. And if you want like the most amazing result as quickly as possible, it's also going to be a combination of diVa, Emsella, bioidentical hormones, PRP, and I think PRP. And that's one of the things that we've really tried to do is put together the best program that gives our clients the most amazing results. And so,
well, and it's funny because you mentioned the difference with women and men. If you watch ESPN or any male-dominated TV station, every other commercial is Cialis and Viagra. I mean, it's ridiculous. But how often do you see a commercial about vaginal health?
Never.
Almost never. Isn't that weird? And, you know, we thought we should do this live with Kathy and I in two tubs sitting back to back, like all the Cialis commercials.
I don't know where we're going with this, but I don't like it.
Which is ridiculous. You know, that was a commercial. It's a husband and wife.
Sorry, Meredith.
No.
Never a dull moment.
But the one thing I want to say for anybody listening out there, Meredith and Ardith are two kind of experts in this area. And as you can tell with Meredith, the same with Ardith, they're wonderful. They're non-threatening. You can talk to them about anything. The consultation has no charge to it. And just let them know, hey, here's what's going on in my life. And they can put together a plan. And I will tell you, they will take amazing care of you. And I think Meredith has said it's one of your favorite treatments to perform. Oh,
yeah. I love it. It offers a reward for anything better than anything, some of the other things that we do, I think, because it's more of an internal building than a lot of external. So, I mean, people get really emotional about it. And I think it's a good treatment. Yeah. Well,
Meredith, thank you so much for joining us today. You've been a wonderful.
See you guys.
as a parting gift, you do get a Tesla, and we're sending a fruit basket to your house. And it's like the Ellen show. You do get something.
I love it.
Oh, big virtual hug.
Yeah.
Miss you
We'll
guys.
see you later.
Miss
See
you
ya,
too.
Ardez.
Bye, Meredith. Okay, so we're still gonna jump on Emsella chair.
Yeah, so we want you to see Kathy get ready to have an Emsella treatment and how easy it is.
All right, so we're just gonna angle this over, and actually you can leave it right there if you want. Yeah. That fits perfectly. All right, you can see everything. All right, so this is all you do. You sit in the chair, and so the provider, there's just some easy buttons on the screen, and so I can actually get myself going. So I'm going to press enter. And the first part of the treatment is just to make sure that you're situated in the right spot. It's a pretty big chair, so it fits men and women of all shapes and sizes. And so you just want to make sure that you're in the right spot. And you as the patient are really the only one that will know if you are. So we help you along with that. But the first part of the treatment, you're just going to hear a ticking. I'm just going to turn it up. And the ticking is just to make sure that I've got basically the vaginal opening is right over the ticking, so that when it starts to do the Kegels, it's not engaging your bum or your thighs. And so I've pretty much got myself in the right spot so I can feel the ticking. And once it gets through the ticking, it will just go right into the treatment. I'm just going to skip through that part and turn it all the way up. And so as a new person to Emsella, if you've never experienced it before, we won't turn it up on you all the way right away. We just want you to kind of, again, make sure you're in the right spot. You might need to put your legs out a little bit further, or maybe a little bit closer together. But we'll talk to you through this process. And then we slowly increase the intensity up to the maximum, which is 100%. So I'm already at the maximum. It's no big deal. And now it's doing the Kegel. And I'm sitting here in jeans, and who would know it?
But you do feel a good sensation.
Oh, I feel it. And, the first time you feel it, it's a little bizarre because it's not anything like you've ever experienced before.
It's totally involuntary.
Right. I mean, but the great thing is there's so many treatments that we do that can be a little intense. And with this treatment, there really isn't any pain. There's not any discomfort.
And we always have people fanning you.
Oh, you have to get closer in.
And then we'll feed you grapes and
Where's
stuff.
my glass of wine? A little rosé, because it's too early in the day for that.
There you go.
So that's it. You sit here in the chair, and you can bring your phone. You can bring your laptop. In the room that we have this device set up, there's a TV, so you have access to Netflix. You can watch shows. So really, it's this simple. It's pretty easy to do.
Minutes.
And so, yeah, that's it. I'm going to pause it. And I'll just bring you back in, and we can switch it over.
So we hope you enjoyed it. It's funny because for years we've been in aesthetics for so long. It's kind of neat that we have this new kind of avenue that we go down versus just like Meredith said, we always work externally. And like I said, this can be life-changing. And if you do want a consultation, like I said, we certainly hope to be open by May 3rd. I think for sure by May 15th. And come in for a consult. There's no charge, and they'll teach you everything there is to know.
And I've personally experienced all of these procedures, so I know that they work for me. And as Meredith said, she's had them. Our team's had them. Our friends and family have had them. We just believe in them so much. I think as a woman, having so many years of not knowing, number one, what was going to happen to my body necessarily, and that was my own fault too as I age. But what happens with a baby and all of that, and then not having any options, it's just been such a rewarding experience for me and for us to be able to offer these treatments of aesthetic care that really are life-changing, that really work. And one of the things that we make sure that we do initially is just like with every other procedure, is make sure that you're a candidate. Because some people, you're just not, they're just not candidates. And so that is something that we discuss in the consultation. So if you have any interest at all, please don't hesitate. Just reach out to us. Again, Matt mentioned the consultations are free. It doesn't hurt to ask questions. And that's really what we want to be here for.
Well, then if there's something that you feel unsure about, or you want, a true medical opinion, we'll set you up with Dr. Amy Carter, who you will love. And again, if you're interested in the hormones, which I'm telling you can be life-changing, we'll refer you to our doctor, and she'll sit down. And we have so many of our friends and stuff who have done it, and we've yet to have somebody go on the hormones and get their hormones balanced in a healthy way that hasn't said, oh my God, that's just amazing.
So worth it. And why did I wait this long?
Yes.
That's what I hear all the time.
One friend of mine who literally, after doing it, said, I would sell my car before I would stop doing my hormones, because she literally said it just changed her life. So, but we hope you enjoyed this Instagram Live. We're going to be coming back on Friday we're going to be a Facebook Live, and it's going to be Red Friday, even though the Chiefs aren't in. We're going to talk about all things red, leg veins and rosacea and cherry angiomas. And, you know, when we look at our skin, we usually see brown sun damage. We see red stuff. So all things red.
You love that topic.
Well,
I mean, it always goes back to the Chiefs
the
around here.
Chiefs.
Yeah.
And then also keep in mind, we are still taking nominations for the frontline responders. Go to our website. If you know somebody, a nurse or a firefighter, or somebody working at a grocery store or a restaurant that is just doing above and beyond during this coronavirus, nominate them. We're going to reward them. We've got all kinds of great stuff. We want to make sure they get recognized. We have our at-home facial kits. It's a wonderful kit. It allows you to do 4 at-home facials, and all our signature products are 20% off any of those. If you go to our website, we'll drop ship them directly to your house. And now we're going to be doing pickup Fridays. So you can curbside pickup. So you can call in, and on Friday we have people here. They'll just run it right to your car.
Yep, I'm excited about that.
So, well, you guys stay safe. And like I said, I think we're getting optimistic now that the worst is over, and we're going to weather this storm. We're excited to see everybody. Our staff, we miss them so much. Our clients, we miss them. We miss the hustle and bustle.
Oh, yes,
and
we do.
We're ready to get going.
Yes, we are.
All right.
Thanks for watching.
We'll see you on Friday. Chiefs.